Here's everything we know so far about the New York City Legionnaires outbreak. On July 28th, the New York City Department of Health and Mental Hygiene issued a health advisory after detecting a cluster of 14 cases of Legionnaire's disease in the central Harlem area. Since then, the number of cases has risen to 58, and as of July 31st, 2 people have died. Legionnaire's disease is a severe type of pneumonia caused by bacteria called Legionella. The bacteria can cause symptoms like a high fever, cough, and difficulty breathing. In the beginning, it can resemble flu or a common cold. But if left untreated, it can become fatal. It spreads through inhaling small water droplets, but it can't be passed between people. Here's everything else you need to know about the New York City outbreak. What is the current death toll? As of July, 2 people have died due to Legionnaire's disease, according to the NYC Health Department. Officials haven't released details about the deceased individuals. How many total cases are there? At least 58 people have been sickened by Legionnaire's disease in the Harlem area of New York City. The exact number of patients currently hospitalized wasn't released, but the health department says it is investigating the cases and caring for patients alongside hospitals in the area. Where are the cases concentrated? The first cases were detected in central Harlem, but officials say they've also found some in bordering communities. What are the symptoms of Legionnaire's disease? Symptoms may start off mild and include a high fever, cough, and difficulty breathing. Later stages can be very serious and lead to pneumonia and sepsis. Those at higher risk, like adults over 50 or people who smoke or have chronic lung conditions, may experience symptoms sooner. How does Legionnaire's disease spread? The bacteria that causes Legionnaire's disease typically grows in warm water. People can get sick by inhaling small droplets of water contaminated with the bacteria. This can happen from sources like cooling towers, whirlpools and hot tubs, humidifiers, hot water tanks, and the evaporative condensers of large air conditioning systems. Person-to-person spread is not possible. How is Legionnaire's disease treated? There are antibiotics that can be used to treat infections. Has anyone died from Legionnaire's disease in the U.S.? Legionnaire's disease was first discovered in 1976 when an outbreak killed 29 people at a conference of the American Legion in Philadelphia. When did the outbreak begin, and how long will the investigation take? The current outbreak in New York was first detected on July. The city health department says it will continue working with hospitals in the area to identify additional cases, perform environmental sampling, and identify the source of the outbreak. What has the New York City Health Department done to stop the spread? So far, the health department says it has completed remediation for 11 cooling towers that tested positive for the presence of Legionella pneumophila, the type of bacteria that causes Legionnaire's disease. The department says it's also working to ensure buildings with cooling towers are in compliance with regulations. Is New York City doing enough to prevent further spread? While critics have praised the health department for its swift response, they're asking for more transparency. At a press conference on July, several reporters asked if officials would publish a map showing exactly where the cases have been concentrated. Officials responded that they want to avoid causing undue alarm and spreading misinformation. Some critics argued that being transparent with the public is the best way to prevent panic and ensure everyone is taking the right precautions. New York City Council member Kristen Richardson Jordan told the New York Times the city needs to move faster because people's lives are at risk. "We don't want to cause fear, but we do need to cause action," she said. And sometimes you have to balance fear in order to get action. Will the city conduct door-to-door testing? Currently, the city is not planning on conducting door-to-door testing for Legionnaire's disease. Testing can be expensive, and officials say it would be more helpful to test water sources for the bacteria. However, community members have argued that testing people is a better option since the disease has a long incubation period and infected individuals may not know they're spreading the disease. One resident told The Times, if they're saying the bacteria is out there, the next question is, how do we find out who has it and get them treatment? Are people at risk of contracting Legionnaire's disease outside of New York City? Currently, there is no evidence the bacteria is spreading outside of Manhattan. Officials say the disease is typically localized and outbreaks tend to be over quickly. Should I wear a mask or take other precautions? Officials aren't recommending people wear masks to prevent the spread of Legionnaire's disease. They also say the disease can't be spread by casual contact. People who are at higher risk should contact a healthcare provider as soon as possible if they experience flu-like symptoms. How common is Legionnaire's disease? The bacteria that causes Legionnaire's disease is commonly found in water, soil, and in air conditioning systems. Most healthy people come into contact with the bacteria every day without getting sick. Legionnaire's disease outbreaks are rare, but they do happen from time to time. The CDC says it receives reports of outbreaks around the country every year. Outbreaks often occur in places with large air conditioning systems or hot water tanks. Why is Legionnaire's disease especially dangerous for certain groups? Older adults and people with weakened immune systems or chronic illnesses are at higher risk of getting sick from Legionnaire's disease. If left untreated, the disease can develop into pneumonia or blood poisoning, which is especially dangerous for those who are already vulnerable. Does the New York City outbreak appear to be linked to climate change? Experts say warmer temperatures can help the Legionella bacteria grow and spread. However, it's unclear whether climate change is playing a role in the recent outbreak. What if I have been exposed to Legionnaire's disease bacteria and have no symptoms? Since the bacteria is so common, millions of Americans have likely been exposed to it and developed immunity. Some people may carry antibodies for years without showing signs of infection. Experts say exposure doesn't necessarily mean someone will get sick. Are there any other diseases that affect the lungs and are spread through water droplets? Yes. Other respiratory illnesses that can be spread through water droplets include tuberculosis, Q fever, hantavirus, and influenza. Do people die from Legionnaire's disease in New York State every year? Yes. New York State has seen up to 6 deaths per year from Legionnaire's disease. Between 2018 and 2020, the state averaged around 5 deaths per year. How is the New York City Health Department notifying the public about the outbreak? Officials are encouraging people in the affected area to visit NYC, GovHealth for updates. They're also posting information on social media and providing regular updates at press conferences. I live in the Harlem area and want to prevent the spread of Legionnaire's disease. What can I do? Residents in the Harlem area are encouraged to contact a healthcare provider if they experience flu-like symptoms. People can also request free water testing from the health department by emailing the Bureau of Waterborne Diseases at the provided email address. Residents can also reduce their risk of exposure by disinfecting cooling towers and hot tubs, heating water to 150 degrees Fahrenheit to kill bacteria, and avoiding inhaling mist from hot tubs, ponds, and fountains. How common is Legionnaire's disease compared to COVID-19? Both Legionnaire's disease and COVID-19 are respiratory illnesses caused by pathogens that spread through respiratory droplets. However, the two illnesses are very different. COVID-19 is caused by a virus and Legionnaire's disease is caused by bacteria. COVID-19 can cause a range of symptoms, while Legionnaire's disease typically presents with flu-like symptoms that worsen over time. There is no overlap in the symptoms of the two illnesses. COVID-19 is spread by the virus SARS-CoV-2 and Legionnaire's disease is spread by the bacteria Legionella pneumophila. People can contract both viruses and bacteria at the same time, but the illnesses would need to be treated separately. Can I catch Legionnaire's disease and COVID-19 at the same time? Yes, a person can contract both COVID-19 and Legionnaire's disease at the same time. But these are two different illnesses caused by two different pathogens. This article will be updated as more information becomes available.